Welcome to the Creation AI Deep Dive podcast series. Today, we're really digging into something fascinating. We're looking at Novartis, a huge global pharma leader. They get a lot of digital attention from healthcare professionals online. But the real question is, does all that noise actually translate into real influence? We're using a really insightful report from creation.co to unpack what doctors are really saying, maybe what they're feeling, and how companies can maybe shape that clinical conversation more effectively.
We've got data from, nearly 3,000 verified online HCP mentions just between January and June 2025.
That's right. And our mission today, really, is to cut through that volume, that noise, and give you some solid evidence-based insights into digital influence. So you'll get a sense not just of what clinicians are posting about, but the sentiment underneath, what maybe isn't getting enough attention, and what's actually driving the narrative on this, digital front line of care. Okay, let's unpack this then, because, on the surface, Novartis is definitely getting noticed online. The sources show, a steady 500 mentions a month from HCPs, sometimes way more. It spiked over 700 posts in May and June, right? Often around FDA approval, so you'd think, wow, they must be really commanding the conversation. But there's a twist here.
Yeah, exactly. It's easy to assume that high volume equals high impact. But the data really challenges that idea. A huge chunk, something like 91% of all those HCP mentions about Novartis, they're just neutral. And when you do see clear sentiment, it's often more like curiosity or maybe caution. It's not really strong enthusiasm or deep trust showing through widely.
91% neutral, wow.
It's significant. And it makes you ask, okay, how do you actually move the needle from just being mentioned to being truly influential? We see this pattern, kind of event-led engagement, big spikes around congresses like ASCO 25 this year, and then it calms down again. It points to a need for, a more sustained strategy to turn that attention into real positive impact.
That's a really critical difference. So if just getting mentioned a lot isn't the whole story, then who is driving the actual influence? Because you said the data shows Novartis's digital footprint isn't evenly spread out.
Exactly right. Influence is very, very concentrated. It comes down to a small group of really digitally active clinicians. We call them DOLs. That's digital opinion leaders. People like Dr. Abdullah Damluji, Dr. Santosh Ambika. Their posts, they have this disproportionate visibility. They genuinely shape how their peers see new data. They can really amplify messages.
Okay, so DOLs, digital opinion leaders, is that the key takeaway here?
Yep.
That focusing on these specific individuals is the leverage point, not just for Novartis, but maybe for all life sciences companies.
I think it absolutely is. If you zoom out, look at the bigger picture. It really underlines how strategically vital early DOL engagement is for everyone. Working strategically with this focus group can massively boost the reach, the resonance of scientific messages. This is especially true for drugs that are maybe early stage or don't have huge visibility yet. Look at the data. Established brands like Kisqali got, 386 mentions, Entresto 314, but a pipeline candidate like PTC 518, 0 mentions in the period we looked at, 0. So it really highlights how DOLs can build that pre-launch story, introduce new science with credibility, with context. And we're also seeing this trend of therapy hybrid DOLs like Dr. Eric J. Topol, people who can connect different specialist groups. Yeah. Very valuable.
Huh. So it really isn't just about the science, is it? It's about the storyteller, the context. And the data also showed sentiment peaked around FDA news in late March. But even the negative stuff, that 4%, which was mostly about pricing from non-HCPs, it shows how fast things can spread online. You need to be proactive.
You really do. And that largely neutral ground we talked about, that's the strategic battlefield. Brands that want to lead can't just be neutral. They need to actively cultivate confidence, curiosity, maybe a sense of urgency. That's sentimental differentiation. You need to spark some conviction.
And timing matters too, right? When should companies be engaging?
Yeah, the data suggests a pretty clear window, Tuesdays, Wednesdays, Thursdays. Almost 80%, 70% actually, of all HCP posts happened on those 3 days. So that looks like the optimal time for, pushing out strategic content, engaging those DOLs effectively.
Okay, so wrapping this up, what's the core lesson here from this Novartis deep dive?
Well, I think the big takeaway, and it applies across the whole pharmaceutical industry, is that reach alone isn't enough. Reach without resonance, it just doesn't cut it. Real influence is built on credibility and, yes, emotion. And peer impact isn't evenly distributed at all. It makes finding and engaging those DOLs, especially early on, absolutely paramount. Scientific stories need good storytellers. And sentiment, that's a strategic asset. You have to cultivate it intentionally, not just watch it happen.
That's a really powerful idea for you, our listeners, to think about. The real edge on the digital frontline isn't just hearing the chatter, it's about responding with precision, with meaning, with engagement that actually shifts how people feel. If you want to learn more about how Seriation.co uses its 27 years of experience in deep social listening, serving most of the top 50 global pharma companies, and how these kinds of insights can boost your strategy, visit www.creation.co. Thanks so much for joining us on this Creation AI Deep Dive podcast series.